My name is Kelsey Rich, and I am a registered dietitian and a certified eating disorder specialist and consultant. I attended Utah State University and received my bachelor's degree in dietetics. At the time, to be a dietitian, it was only a required bachelor's. That has now changed, and it is a required master's degree. I was in the coordinated dietetics program at Utah State. This meant that I did my coursework and required practicum internship hours all at the same time. My practicum hours were done in hospitals, long-term care facilities, community programs, and commercial kitchens. I was mostly interested in the clinical and hospital settings when I was a student. After I graduated with my bachelor's degree, I took the RD exam and I decided to obtain my master's of nutrition science degree from Utah State. This was a 2-year program, and during this time, I conducted a research project that involved working with preschool-aged children and their parents. I also took coursework that related to my research study and my thesis. I worked during this time as a teaching assistant and a preceptor for undergraduate students. I would bring undergraduate students to the hospital and assist them with their nutrition assessments that they were performing. After I graduated with my master's, I worked as a clinical dietitian at a hospital for a year. I had always had some interest in working with eating disorders, and there was a job that opened up at an eating disorder treatment facility. I applied for that job and I got it, and I worked at that eating disorder treatment facility for 6 years. The facility that I worked at did all levels of care, so there was inpatient, where a patient needs more medical care and monitoring. There was residential, where they are still there 24/7 but need less medical monitoring. Day program is where a patient goes to programming during the day and then they go home at night. Intensive outpatient, where they come a few days a week for programming, and then outpatient. Dietitians do not receive a lot of formal eating disorder training in school, so the first year at that job was a big learning curve, learning like counseling techniques, learning about medical complications associated with eating disorders, and just learning about like general eating disorder information. There is a lot of misinformation about eating disorders that are even commonly taught in school. And I was also learning all the rules at the facility that I was working at. And there was a lot of rules to try and help patients not engage in their eating disorder. I became a certified eating disorder specialist while I was working at that treatment facility. This certification is obtained through coursework, passing an exam, and a minimum of like 2,000 hours of supervised hours of working directly with eating disorders. In 2019, I opened up my own practice, and in my private practice, I work with outpatient level patient, or doing outpatient work with eating disorders and disordered eating. I utilize intuitive eating, anti-diet, and health at every size philosophies. I provide both in-person and virtual appointments. My day is usually just filled with back-to-back appointments that are 30 to 60 minutes long. We review goals from the previous sessions, discuss barriers and triggers that have come up, and set new goals. Topics that are discussed in session vary based upon what is coming up for that individual, and but they might include like incorporating challenge foods, portion sizes, eating regularly throughout the day, hydration, body image, and healthy relationships with exercise. I work closely with the patient's therapist and medical provider. My favorite thing about my job is that I get to know my clients really well. Many of my clients have been seeing me for several years, since it does take a long time and a lot of work to recover from an eating disorder. I also love to see the progress that they make and seeing them live their lives more freely without their eating disorder. The hardest part of my job is hearing about some of the hard things my clients have endured. Many have severe trauma. It is also really hard watching them struggle, engage in behaviors, or relapse. I love my job, and I feel really lucky to be part of so many individuals' recovery journeys. If you're interested in working with eating disorders, I would recommend completing a degree in nutrition, obtaining a master's degree, and either working at an eating disorder treatment facility or obtaining supervision with someone who is an eating disorder consultant. I may be biased, but I think I have the best job, so I'd highly recommend working with eating disorders if it's something you're interested in.